Hi, I'm Mallory Kalia. I'm going to be analyzing the COVIDLand video, a film about survival and hope in the ICU. So the first key, which was successful engagement by a healthcare team, they used empathy and transparency. They communicated honestly with the patient about his condition and his prognosis, and you could really tell that their compassion just really helped him feel seen. This is something that's really close to my heart. My grandma passed away from COVID in the hospital in a very similar situation. She was a surviving kidney transplant patient of 25 years. And then when she got it, it just really took a toll on her and she never recovered. So the course was very similar to the one in the video, which was a little hard to watch. But she was on BiPAP, and I think the biggest thing was that the team had really good engagement with my mom, who was her biggest advocate, my grandpa as well, and just letting us know, hey, these are the options. This is what we can do. This is what we haven't tried. This is what we don't think will work. So there's a lot of shared decision making. So rather than just telling him what they were going to do in the hospital, they kind of partnered with him. And I really appreciated that the physician used like therapeutic touch with him. And since he clearly wasn't able to have family there, that it was just reassuring for him to have someone who, even in those hard times, even though it's a doctor, that they're able to provide therapeutic touch and just, explain things in a way that was really easy for him to understand. They really humanized the experience. And honestly, sharing the story through the documentary, I think it would have resonated with a lot of people, just like it did with me. It's those small moments, I feel like, that really show patients that you care, and that's where I saw a lot of examples of that in this video. Ways to strengthen engagement through technology. So virtual communication tools. I know a lot of hospitals used iPads. We were able to do like some FaceTime calls with my grandma, but I think obviously it's a financial thing, but having iPad available in every room, like at Children's, we have iPads in every room. Having something like that where patients and their families can communicate when they're in this situation would be really helpful, because I know I get it, because I've been there, and it's really hard to watch your family member go through that and not be able to visit them and not be at the bedside. So to be able to have another way to communicate would be great. And family portals, so like Epic, like my chart where we could see results, imaging results and all of that stuff is another way to involve the family. Interactive education platforms, so explaining ICU treatments and recovery expectations using like visual resources. I think people kind of had to get creative because so many families are not medical and not medically literate, and being able to explain, this is what intubation means, this is what Precedex is, like these are what XYZ, all of these medications that we're putting them on, these are how they work. This is what we think is the best option, stuff like that. And then telehealth follow-ups afterwards to stay and help with continuity of care. But overall, COVIDLand showed that healthcare providers and patient engagement are really important, that we can be empathetic and open and collaborative with these patients and their families and with each other. And I think pairing those human qualities with thoughtful technology, we can bridge communication gaps, strengthen trust, and ensure that patients and families remain active partners in their care inside and outside of the hospital.